Yesterday, the Chief Medical Officer of Health, Dr. Deena Hinshaw, announced that there are 1,089 people in hospital with COVID-19. And of those admitted in just the last week, 73 of them were children. 104 Albertans are receiving care in the ICU, including 7 children under 1 year of age. We're quickly approaching the numbers of Albertans in hospital that we saw at the peak of the fourth wave. Doctors are raising the alarm, describing the situation inside some major hospitals as chaos. Beds are full and staff are scrambling to find space for patients in rooms and hallways. The pressure on our hospitals is growing at an extremely concerning rate. After 2 years, Alberta's healthcare heroes are running on empty as they deal with massive patient demand while many of their colleagues are out sick. Yet we have heard no plan from the UCP government. We haven't even heard an acknowledgement of the situation. Major universities have pushed back in-person learning once again, and there is no help coming from the province to help them reopen safely. K-12 schools have been back to in-person learning for only 1 week, and in that time we have seen extremely high absenteeism among students and staff due to illness, isolation, and concerns over safety. Yet still no action from this UCP government to ensure that schools can remain open safely. Instead, what do we see from the UCP as this fifth wave slams into our province? Well, we see them continue to slander and attack healthcare workers. We've seen layoff notices start for 11,000 healthcare workers who ensure that rooms and bedding are clean. We've seen UCP MLAs take to their Facebook feeds to criticize our healthcare system, where just this week, UCP MLA Peter Guthrie called Alberta's healthcare system bloated and underperforming. I suggest Mr. Guthrie talk to an emergency room nurse or a paramedic or a healthcare aide. I think they'll tell him that what's bloated and underperforming is this UCP government. A government that continually shirks its responsibilities and then blames others for its many failures of leadership. What we need to see first is transparency, honesty, and in fact, any kind of accountability from this government. Albertans deserve to know the actual numbers. We have called repeatedly for the 2-week hospitalization forecast to be made available to Albertans so we can see what the potential impacts are, indeed how we are currently tracking what we have seen nothing. No information, no data. Dr. Deena Hinshaw stood this week and said she is not able to provide that, yet she is the only official that this government is putting forward to discuss the situation. So we need the data and we need the numbers. In terms of whether we should be reaching out to the federal government, military, other sources, certainly I've heard from some frontline healthcare workers that they feel the situation is approaching a level where there may be that need. But again, I think we really need to have this government step forward, answer those questions, provide that data on the record so that they can account for what they are considering, what options are on the table, and what Albertans can expect as these hospitalizations continue to rise.